We have people joining in at a very rapid pace. So we'll wait for a little couple of minutes more till more people join in. The people are joining at a very fast rate right now. A very good evening to all my panelists, colleagues, and everyone who's joined us this evening. On behalf of Anant National University, I welcome you all to the 11th webinar under the By Design Knowledge Series, where we explore the world of built environment and design thinking alongside a panel of prestigious speakers. I am Ashima Banker. I head the Masters of Urban Design program at Anant National University. Our webinar today is titled Land Use Implications of Building a Healthy City, and it is jointly organized with the USAID funded Building Healthy Cities project under the John Shaw Inc. Indore, which has also been named the cleanest city in India for 3 years in a row, has taken groundbreaking steps to improve the health of its citizens. Citing examples from BHC's work in Indore, the webinar intends to identify efforts needed to change the built environment for healthier cities. Today, we would also aim to explore in this discussion how land use approaches, design principles, and regulations can create cities which are more healthier. Let me begin by introducing our eminent speakers for this evening. We have with us today Amanda Pomeroy-Stevens of John Snow Inc., JSI. She is the project director for the USAID Building Healthy Cities project. She holds a master's degree in applied economics from Cornell University and has about 15 years of experience in research and evaluation. Amanda has led work for JSI on urban health, non-communicable disease prevention, and nutrition financing and governance. Her areas of specializations include economic evaluation, complex survey analysis, and system strengthening. Prior to JSI, Amanda has held positions at ICF Macro, RAND Corporation, and the Center for Strategic and International Studies. We also have with us today Rejeet Matthews. Rejeet is heading the urban development at WRI. Her work revolves around the integration of land use and transport, sector design, alternative mechanism to acquire, plan, and service land, city and regional master plans, capacity building, revision of town and country planning acts, and understanding the trend, nature, and impact of urbanization in India. She has provided technical inputs in various reports, guidelines, policies, and committees at city, state, and national levels in India. To take the discussion further, we are also privileged to have with us Dr. Anuradha Jain from the USAID India mission. She is a clinician with formal training in public health. She has been actively practicing public health for the last 15 years and has served in various prestigious national and international organizations like National AIDS Control Organization, National Health Systems Resource Center, Save the Children, and INCLEN Trust International, and has been working with USAID for the last 5 years. Dr. Jain has contributed to conceptualization and operationalization of some of the national flagships like Rashtriya Bal Swasthya Karyakram, Janani Suraksha Swasthya Karyakram, India's Newborn Action Plan, background papers for ILEG and health section of 12th five-year plan of the country. At USAID, she works towards health systems, strengthening to accomplish USAID's commitment of making universal health coverage a reality for the vulnerable populations in India. Her work primarily focuses on comprehensive primary care, both urban and rural, urban health, and human resources for health. Without taking too much time now, I would want to hand over the session to take it forward by Amanda to talk about the BHC work in Indore. Over to you, Amanda.
Thank you. Welcome, everyone. Let me just share my screen. Great. I'm just going to kick us off with a little bit of a background on the BHC project and of Indore, for those of you who aren't familiar, and how we're working together to improve healthy urban planning. So the Building Healthy Cities project is a 5-year learning project that started in 2017, funded by USAID. We're working with 4 smart cities across Asia who are growing rapidly, and so thinking about how to develop in a healthy way. And we're testing new models for healthy urban planning. Our overall approach, as I said, this is a learning project, so we're learning as we're going, but we're about halfway through the project now, 2.5 years. And what we've learned thus far is pulled together in this graphic. And really what we're finding is that at the heart of healthy urban planning, we are focusing on multi-sectoral engagement, data-driven learning, also known as data-driven decision-making, and citizen empowerment. This is a big part of urban planning in general, but especially in thinking about how to grow a city in a healthy, livable way. On the outer circle, you see some of the individual activities that have come out of this approach that we're working with each of our cities on. This includes things like participatory planning and budgeting to make sure that aspects of city living that would make it healthier or more livable are included in the work plans and budgets for each sector each year. Health education, work to make sure that access to health is more equitable across all citizens. This includes access to services, and not just health services, but also other city services like waste management and transport. Skills building for both those providing services and those who are receiving them. And then a lot of work around environmental health, including air and water pollution, mitigation. This ties into clean cities work, which you'll hear more about from Indore, and then livable cities, which includes things as far afield as healthy tourism, which also affects the livelihoods of those living in these cities. One of the things we have not touched on yet is how land use ties into this. And so before we get into that, I just wanted to give a little bit of background on Indore specifically. So Indore was one of the first cities that BHC worked in partnership with on this approach, and they've been a very active, engaged partner. If you are not familiar with Indore already, I'll just give you a few bullet points. Indore is a very fast-growing commercial capital in Madhya Pradesh. Their population at latest measure was about 2.5 million, and they are growing at about 3% each year. 30% of the city population, again at last measure, were in informal settlements. And these are at varying different levels of time of living. So there's decades-old informal settlements as well as new informal settlements. Indore has, as you may have heard, won the Cleanest City in India award for the last 3 years. And this is based in large part on major improvements around waste management and sanitation, which also included a large citizen engagement campaign. In 2016, Indore was named as a smart city by the National Smart City Mission, and the Indore Smart City Development Limited, or ISCDL, which you'll hear me reference often in this presentation, is the special purpose vehicle that runs that. Now, the map on the right-hand side of your screen shows the area-based development plan for the smart city in Indore. And so this ABD is where they generally are working, and they have thoroughly mapped this area. If you think about the larger land use in Indore, there are multiple different municipal, district, and state bodies that help to run land use. This is an image from our 2018 political economy analysis, which shows the different bodies who were given responsibility within the 2006 Indore City Development Plan. A formally approved master plan, which is defined at the state level, decides land use in the city, and many of the decisions on green space mentioned in the master plan have to be cleared at the state level. However, ISCDL and the Indore Municipal Corporation have requested and can request additional changes to commercial and residential land use through the district collector and the Town and Country Planning Commission. One more piece of information that might be helpful for this webinar to understand is how much of land is developed already in Indore. This chart breaks down land use by type and how much has been developed to this point. And it shows that there is still quite a bit of opportunity to strategically plan the remaining undeveloped land in the city. BHC, as I mentioned, has been working with Indore for 2.5 years now. And you can see in this infographic a depiction of all of the different areas that we have been able to engage with them and work in partnership to make improvements. However, most of these activities that we've undertaken thus far haven't really changed the built environment in any significant way. ICDL has done quite a few built environment improvements, but in terms of this healthy urban planning approach, we haven't broached the topic of changing land use. And that's part of the impetus for this webinar today. We're so excited to be a part of this conversation and to be able to hear about how to make some of these longer, more sustained changes. One other aspect of our project that I'd like to mention is that we have been doing a participatory process across the different sectors and stakeholders in Indore and our other cities to come together with a common definition of the context that we're working in, some of the barriers and opportunities in that context, where there's leverage points, meaning where are there opportunities to make big changes with a few interventions. And then from that, coming together to decide some collective actions that Indore can take to become a healthier city for all citizens, from informal settlements all the way up the income ladder. These collective actions that I'm talking about are complex and would be broken down into sector actions, but we're finding it's important to think about how the sectors work together, not just for efficiency of use of resources, but also to make sure that everyone's agreeing on the final goals of the actions. So I'm just going to give 2 examples. We're still very much in process with these, and because of COVID restrictions, we have not been able to do some of the final consultations with our city stakeholders to really finalize this suggested list of actions to bring to the city. But for the sake of this webinar, I want to bring 2 of our draft actions to the table to think about what are some of those land use considerations. The first one that came out is around food and nutrition and thinking about how to increase the equity of the food system. So the goal is to lower malnutrition and foodborne disease while improving livelihoods in Indore. Indore is a city of food lovers, but access to healthy foods is not always equal across city neighborhoods. And in fact, in a recent study that we did in partnership with ISCDL on non-communicable disease, we found that in slums, junk food sellers actually outnumber healthy food stores 3 to 1, and malnutrition is quite prevalent in those areas. In non-slum areas, the ratio is more 1 to 1. So the proposal that's come out is that we provide safe, green, and legalized hawking space for safe and healthy foods in these informal areas, in the informal settlements. And this would be in collaboration with ICDS, which already has some access to rations for those who cannot afford food. So this could also provide a vehicle for distribution. The second example I wanted to bring to the table is around a community-led pollution control approach. And the goal of this is to improve air quality and livability in Indore. Now, Indore compared to other Indian cities might not be one you'd consider as having bad air quality, but if you look at the numbers in 2019, air quality actually exceeded the WHO levels, safe levels of PM 2.5 5 times over. And as the city's growing quite quickly, the pollution will continue to grow. Indore has succeeded in engaging citizens through the Swachh Bharat campaign, but we want to see how they can engage them on addressing air pollution as well. So the proposal that's come out is to use a community-led pollution control approach to change city residential planning including the introduction or expansion of pollution mitigation efforts, particularly in residential areas. And I'll mention that while there is a network of 6 air quality monitors in Indore, only 2 are in residential areas. So to bring to a close this presentation and move us into the bulk of what we're going to be talking about today, I just wanted to mention our next steps. We're continuing to do this action planning with all of our different sectors. There's about 8 different sectors involved. And once we've been able to finalize those consultations, we're going to be editing these with ISCDL, thinking about how to adjust them to the new COVID-19 context, and then finalizing this action plan with ISCDL and our other partners. And then we have to operationalize each of these actions so that they're actually doable. And this means considering all of the functional details. We have to be able to answer the question for each one of these: what will it take to make this action successful? And so a big part of that is going to be around what are the land use implications, what policies need to be changed, what regulations need to be changed, et cetera. And so for today, I'm hoping we can kick off a discussion on this topic by thinking about what changes can be made to municipal land use to make each of these actions successful, or similar actions successful. So with that, I will thank you and share with you our contact information for this project, and hand it over to my esteemed co-panelists.
Thanks, Amanda. I think that was a very quick overview of the Building Healthy Cities project, and that kind of gives a background to the whole discussion about, one, that yes, needless to say that, you know, those access to health facilities and the social and the institutional dynamics that exist are important. But nonetheless, now I would want to change the lens of looking at the same story that we're talking about, which is about building healthy cities. The point of concern is the same here, but I would now want to change the perspective through an urban planning approach, and see how through urban planning, or through planning approaches, through land use design, what can we do where these things can be addressed, some of the aspects of hawkers, or the air pollution and some things like this can be addressed. So I'll just like to talk about that. So my questions for today is, I'm actually trying to question my own self. Can healthy cities be designed? And that's where I begin with. I'm not too sure if this is really possible, because we've known these ideas, what I'll talk about, for a long time now. But nonetheless, our cities still suffer pollution and other issues which affect the health of people. So, you know, cities are what it comprises of various activities that happen in the cities, the way people live, the way people interact and play, the way people produce, and the way they consume, and the connections and, you know, interrelationships of these activities, the movements between these activities. And as you can see, all of these pictures have 2 sets, and 2 very contrasting sets of images that are there for those who have access and for those who do not have access, and which is very prominent in many of our Indian cities. And what really is translated, so this entire, all these activities, which some of them which are intended, some of them which are not intended, and they happen spontaneously by some reason or the other because of an impact of a certain land use, are defined, and the movement between them. This is all defined through one simple exercise in India, what we call is a development plan or a master plan, which we make, which is for the entire city, which essentially boils down to land use zones and planning norms, which again define what we can do in which land. So that is what governs everything. With all the lofty ideas many cities have had, you know, cities which are more livable, cities which are green, to have cities which have economically robust, and all kinds of lofty ideas. But unfortunately, the ideas kind of get loosened, and they lose their roots when the moment they come down to the local area level. And sorry. extremely sorry. And so what happens when, when we do not really address these issues at the larger level as well as at the local area planning level, is when our cities actually face the health crisis. As per the Global Burden of Disease 2017 study, 9.95 million global deaths were worldwide were due to household and ambient air pollution, which was indoor and outdoor. Out of these, 1/4 of them were from India, and half of the 2.7 million deaths, which were due to poor water, sanitation, and hygiene, were almost half of that were in India. So it just clearly shows that we are not really paying the kind of attention to these things, what we can actually rectify, and it's not really something new. Way back in 1854, the relationship between how activity, infrastructure can affect health of people was mapped out by John Snow in his map, where he mapped the cholera cases in London's West End. And it very clearly identified a pump which on the Broad Street, which was the reason for the cholera outbreak there. So land use implications on health actually they affect the air. I mean, they're affected by various things like the air we breathe, the quality of spaces in which we live, work, and play, the water that we drink, or the way we move around, what kind of food are we eating, what kind of access do we have on healthcare services. Just a second. I think, is it that you people cannot see the presentation? Sorry. Extremely sorry. I don't know from where you were not able to. I'll just quickly go through the slides very quickly, talking about the different activities that were happening in the city, which are essentially dominated and governed by the land use plan, the zoning exercise that is done in India, which is a development plan or the master plan. And it essentially does affect the health. It translates into the health that affects in the residents of the city, and which is not coming out in a good picture because of the reason that we are not addressing those visions or those ideas, lofty ideas that we have at the larger city level, to the local area planning level. And it's not something very new. We have already seen the cholera case of London outbreak, which identified the Broad Street cholera cases to just one pump on the street corner, is a very clear indication that we have known since a long time that what we do to our cities, the way we build them, is affecting the health of people. So, I mean, like I said, the ingredients of healthy cities are to have cleaner air, cleaner water, hygienic sanitation facilities, healthy food, living and working in buildings which have good natural light and ventilation, and promote active lifestyle. But how much of it is actually done when we actually come to designing and looking at our cities? So what I'm going to now today talk about are 4 themes or 4 approaches, which again, as I said, are not very unique or not very new, but it is the way those things now need to be translated into when we make our local area plans, or when we make a smaller neighborhood plans or sector plans that we do. One very integral component, efficient public transport, has been promoted for different reasons across the globe, and in India as well, because of the reason that we want to make it affordable for people. We want to make it to make it safe for people to travel. We want to give them the ease to travel. But do we really achieve that to the fullest? Maybe yes in some cases, but maybe no in most of the cases. The main reason behind that is that the last mile connectivity, which is often comes as an afterthought or is left to be discussed or implemented later, most often either discourages people to use the public transport or does not fulfill its full purpose. And another important thing along with that is also encouraging non-motorized transport. Many cities have tried to do that, Delhi, Bhopal, who have tried to talk about biking and all these aspects from the public transport to their houses and to the origin and destination is very important. Now, what's also required for that is just saying that you're providing cycling provision of a renting bike is not enough. The infrastructure that is required for walkability or for bicycle lanes is equally important, which unfortunately doesn't happen that effectively. Or if it is there in bits and pieces, and it's not a comprehensive neighborhood level or a city level plan for that is implemented, which also kind of comes to the fact that our cities, people don't really prefer to walk or cycle because they don't find it safe. Now, JNNURM and now smart cities, these programs and projects do finance many of these tasks, projects in various cities across India, and they've done that. But the last mile connectivity, as I said, has not been still addressed properly. And they need to be thought well in advance when anything in cities. So they have to be mainstreamed in the thought process and not as a later on and afterthought. Also, the next point is creating walkable neighborhoods. Now, again, this is something, it seems like, oh, obvious, you need to have a walkable neighborhood. A neighborhood in which you could probably walk down to get your vegetables, to groceries, your milk, and you could probably walk down to a park. You could have shaded walkways where you could walk, and everything is very accessible. And so if you do not really need, you will not take out your private vehicles. But how much of it does it actually happen? It does not. So traditionally, if we look at our Indian cities are known to have mixed land use. All of our old city, whether it is Ahmedabad or it is Jaipur or Delhi, they have always worked like that because they were always designed for pedestrian movement. And so maybe the walkability was primed at that point of time. And so mixed land use is something which was giving life to these spaces. Why are we negating the fact that mixed land use can come to our savior here as well in the newer peri-urban areas, which are mostly being developed as either segregated land uses or land uses which have concentration of these marketplaces or one pocket. And so there'll be one pocket in the neighborhood which will really have to walk a lot to reach that point of the market. This brings me to another topic of reduced urban block size. Now that again links us back to the old cities. If we look at the old cities of India, the way they were done, older cities they had very smaller urban block size. An international example, a very good one of that could be seen in Denver, where the block sizes are so walkable and people can cut through different blocks. The diagram that is shown on the bottom left corner indicates that, and that's what you are giving the people comfort and ease of walking. Instead, what's happening in the case of most of our peri-urban areas, here the case that I've shown is of Western Ahmedabad, is where we have large communities, societies, which are primarily gated communities. The moment you have gated communities means they have boundaries, they have limited access, entry, exit points are controlled. And so people really cannot cycle through or walk past these large blocks, which are usually owned by one society, builder, developer, and things like that. So those are the things that are essentially needed to be looked at. And if some of these things can be captured when we do a local area plan, then maybe things can be different and people will be more encouraged to walk, and they'll be probably the moment you walk more, one is that your health is good, and second is you are burning less fuel, so less pollution, coming to Amanda's point. The last and the final point that I'm trying to make here is a concept of urban agriculture, very well used in many of the international cities in Europe and across the world. Havana in Cuba is one very good example of where about 50 to 90% of the fresh produce is grown within the city limits. And this is all institutionalized by the Ministry of Agriculture, where all of this thing is actually being done by people themselves. These are all agricultural enthusiasts who intentionally want to get involved into growing food. And so there the case is a little different, because the land over there is owned, the entire land is owned by the government. And so it's very easier for them to decide on which land you would grow vegetables, and you'll have agriculture produce. In India, although the land is owned by private owners, developers, and other private owners, but it can definitely be, I still see that the lot of peri-urban areas, land parcels which are kept on hold by developers and builders for them to either wait till the development comes that side, or for the land value to escalate before they start building anything there. It lies vacant for many, many years. So those are the land parcels that I'm talking about, and maybe incentivizing these developers and private landowners in some way, in terms of some kind of a levy to their property tax till the time they give the land on lease to government for doing these urban agriculture. And this can definitely, one is produce a large amount of food for the neighborhood, so people can get fresh organic food. Second, people can also get a lot of, people would not need to transport food from the wholesale centers which are in the center of the city to these peri-urban areas. So the reducing of transport, and thus also the pollution. Also, these vegetations which are grown will further act as carbon sequestration to whatever extent they will. But to some extent, they would, kind of make the air more pure and more cleaner for us to breathe, and maybe the cities would become more healthier. So these are just the 4 sectors that I was wanting to talk about. So that was my perspective of bringing the urban planning, urban design perspective into how cities can effectively actually be healthy. And from here, I would now would want to invite Rejeet to discuss her experiences and her thoughts on how we can actually achieve them on ground, or what are the challenges that we face in this front. Can we have Rejeet's presentation on?
Thank you, Ashima. And while the presentation is loading, I'd also like to thank Anant University as well as USAID and their project on building healthy cities for having me here. So the perspective I would like to bring in is also one, I mean, we've already seen what Amanda's laid out, what Ashima's laid out. So I'd rather take it from there and zoom out a little bit to see how is India doing. In many ways, if we can go to the next slide, India is actually on a growth trajectory, right, in terms of urbanization. We will continue on this path up to 2050. This graph that you're seeing on your right, we have about 400 plus million urban residents already in India. We will be adding another 400 by 2050. But also the amount of land that we are going to consume is almost 5 times more than we've already consumed today. So that's a lot of land that we're going to consume. Land definitely is fixed, but its conversion to urban use is going to happen rapidly. How is it happening and what do we do about it? We can see in the next slide. Amanda had spoken about Indore, and so I'd also like to just show you how Indore is growing. What you see in these various colors is in gray, it's the amount of growth. By built up growth, I mean either buildings or roads and other paving, etc. In gray, you see how much was built by 1990. Yellow, orange, and red shows you what happened in the last 20 years in many ways. So you can see a lot of the growth actually happens outside of municipal boundaries. And then what happens is, so the municipal boundary starts trying to catch up with this growth. The master plan keeps trying to extend itself out. So a lot of it actually does not get captured. Neither is it municipally serviced, nor does the master plan address this. We can go to the next slide. this one will give you a good image. I mean, and this is of Bangalore. It's a city I grew up in. So a good example here is, if you look at, the left two images, one is of Jayanagar, the other is Vijayanagar. These are areas within central areas of Bangalore, that were, some of it was planned, some of it grew accretively, but definitely not as rapidly as Whitefield that you're seeing, the last image of. It's very clear that a Jayanagar or a Vijayanagar has a much higher road density than Whitefield. Whitefield looks still fairly rural in terms of its road network, what you would see through agricultural fields. But you'll be surprised, and those of you who know Bangalore well, this is the IT capital of Bangalore, in many ways known internationally as well. This is where ITPL is located. This area is completely built, but as you can see, the amount of road networks, it's really not increased. So this brings many challenges. If this is how our peripheries, and Whitefield is a peripheral area that grew very rapidly, it causes a lot of issues. Ashima was talking about block size. You can see if you locate a point A and a point B on this image of Whitefield, to get there will be very difficult because you have to take very long routes. There are no, it's not a multiple choice option here, right? You have to take a very long route, go around and walk it. So it becomes unwalkable, which also means you're using your car, using many other unsustainable modes rather than having to walk or bike quickly. This also has indications for infrastructure provision. Where do you lay your trunk lines and your distribution lines? It has implications for land use. For example, this area has almost no public open spaces. You might have in private spaces, some of these are large gated communities as well, but there's no public access, open spaces, poor infrastructure, poor garbage collection. So you can see, all in all, you're sort of locking yourself in for a very long time in terms of unsustainable urbanization. So this is some of the challenges we are facing. At the same time, while we're looking at urban growth, we're looking at street networks, lack of open spaces, lack of infrastructure, we should also address the informal sector, right? On the next slide, if we go, the next slide actually shows, I think it's not moved yet, but as it comes, I've referred to the Kundu Committee report, which came out in 2012. Has the slide moved? It hasn't for me, so yeah, it's moved now. So this is, at the end of the day, we know whether it's the informal sector, it actually constitutes 50 to 80% of our economy. But that does not mean everybody in the informal sector is not well off. Here we're looking at that part of the informal sector which is not well off. The first bar that you're looking at, it shows the lack or the shortage of housing in India is about 18.78 million units. Now, 18.78 million units, out of which, why is it not, why is there a shortage? It's not necessarily homelessness. If you look at the next bar, homelessness is about 3%. 97% is because these homes are either not serviceable or obsolescent, in many ways meaning structurally not stable, or in precarious places, or congested, like 10 people sharing a room, for example. So this actually is a matter of not having an adequate house. And if you look at the third bar, it's like, who does not have an adequate house? It's largely, again, 96%, as you can see, is in the lower income groups as well as economically weaker sections. It's not the middle income groups, it's definitely not the high income groups. So it's really the LIG and EWS facing this struggle. Just a point here, how many of these people, this 96%, are actually involved in decision making, in policies that are targeted at them? We put out millions to target these people in terms of giving them houses, infrastructure, etc. But has anybody asked them what they require? So if you go to the next image, just to give you a view of what does the ground situation look like. These are areas we've studied through the organization I work for, which is the World Resources Institute in India. You can see it's a lack of infrastructure, sanitation, and just overcrowding. So people tend to come out onto the streets to work. And these are the most vulnerable communities. They're most susceptible to shocks. And by shocks, I mean, for example, economic shocks, right? The COVID situation, I can work from home, definitely. It has not disrupted me as much as many others, but for daily wage earners, it's an extreme economic shock. When it comes to, for example, climate-related events, supposing it's heat stresses, flood, etc., again, they're the most vulnerable. When it comes to health, which is what we're talking about today, again, they are the most vulnerable. What is their access to health infrastructure? What is their environment like to enable better health outcomes for them? Quite, dismal in that sense. If you can go to the next slide. Thank you for moving the slides, Harsh. Really here is a point of reflection on, hence, what can we do? Where do we go from here in terms of, the land use implications of building a healthy city? Where do we start? There are many levels to start, and what I will do is, in 5 slides, suggest 5 recommendations, which could be addressed, of course, has to be suitably addressed in each city. Every city is different, every state is different, everybody has different legislation. So we'll have to see how we go forward. If you can go to the next slide. Here's the first one. How do we look at down-top approaches in policy formulation? Right, so here is the image you're looking at is workshops we've done. This is an area called Rajokri in Delhi. We've also been to many other settlements where you have urban villages, you have slums setting up near them. At the end of the day, like I mentioned, say affordable housing schemes, right? If you give them basic infrastructure like a house and physical infrastructure linked to it, it will definitely improve their health outcomes. It'll also improve their own investment in infrastructure, right? And that's the disjunct we see in policy today. For example, affordable housing schemes, whether led by the center, whether led by the state, do not talk about, say, tenure security, right? And many of these people that we spoke to in this image, they've been living in their homes for 30 years, but they're still very scared of eviction. And in their priority, they said, no, we'll talk about infrastructure later, we'll talk about health and education later, give us tenure security, give us a right to use this place, and we ourselves will contribute to all of the other things. So that's actually important to understand, do our policies understand the linkages between, the informal sector, their livelihoods, the informal economy, etc., when it's formulated? So definitely a down-top approach needs to be brought in as we go forward. Can we go to the next slide, please? Yeah. Here is something on land use plans, right? We're looking at land use planning and how that can enable better health outcomes, especially in the informal sector. So one, most of our town country planning acts in India, and we've assessed a lot of states now, at least 15 states we've assessed, most of them have had piecemeal amendments over time. What are town country planning acts? These are the acts that determine how your master plans are formulated, what land uses you can put in your master plan. So they've had piecemeal amendments, need-based, but nobody's done a comprehensive revision. Sorry, I shouldn't say nobody. There is a model act in place. A few states have implemented this, like Kerala, for example, but most have not. They do not acknowledge scales of plans. For example, you saw the amount of growth that's going outside the city. Is there regional planning within many of these town country planning acts? There is not. Is there local area planning, which is sort of at your ward and neighborhood scale? Is the town planning scheme? So many of these are missing in legislation itself. So then, when it percolates down to the master plan, there's a lot of gaps here. Mixed use categories. I mean, Ashima was talking about how mixed uses can bring in better activity on the streets. It brings in a lot of benefits. People typically work and stay in the same place, especially in the informal sector. So to acknowledge mixed uses, for example, a master plan I had worked on in the past, we actually had to use, sort of a main category, ancillary category. There's many ways in which you have to sidestep these, sort of rigid, do it as residential, commercial, industrial only kind of uses. Similarly, as you can see these plans that I've showed you, what is the difference if you look at these master plans? These are all in Karnataka. It's just red, blue, green, yellow in many ways. But if you bring in strategic projects, a master plan cannot just lay a legal layer on your city and say, now let the people follow it. It should also be development led, which means strategic projects need to come in. And strategic projects, for example, the push from the center to do smart cities and area-based development projects like what we're talking about in Indore are a good way to trigger change. Bring in a good example, trigger a change, make a threshold so that it affects other areas positively and that growth happens. So this is another bit on revising dated legislation as well. Can we go to the next slide, please? The third point I'd like to state is, how do you enable and sustain democratic institutions? It's great if we have schemes from the center. They also come with finance and some sort of push towards reforms. The JNURM had it. The second phase also has it to a good extent. But definitely, if we look at, say, the 74th Constitutional Amendment Act, it says decentralize power to the urban local body. Give them planning functions, let them regulate land use. Today, it's mostly development authorities or town planning departments at the state level if there's not enough capacity at the local level. So devolve it to the municipality, build their capacities, and help them sustain over time. This will bring planning closer to the people and the needs of the people. Similarly, constitutionally, there's the requirement of a ward committee. There is, suggestions of doing area sabas through community participation laws. So some of these should be instituted to maximize representation. And we're talking about the informal sector, and there's an interest in, sort of vending as well in this project. So setting up those town vending committees, these are it was enacted in 2014, the Street Vendors Act. I think it's a very good act and it should be used well. So it definitely looks at protection and of livelihood in the street vending categories, how vending zones can be formulated. I even saw documents, for example, say NIUA talking about how do you manage this on streets, how do you bring it into street sections, etc. All of these being important as well. So can we go to the next slide, please? This is, while it's partly there in, what we call as the Town Country Planning Acts, they should institute local area planning. I believe this slide is only half loaded, but yeah, okay, it's come. Sorry, maybe one more button. I think there's an animation on it. If you can press, yeah. So this is talking about instituting micro level planning processes. Ideally, they flow out of master plans. Gujarat has made a good amendment which said that if you want to do a micro level plan like a town planning scheme, you can even do it outside of master planning jurisdictions as long as it touches an older TP scheme in the past. What are these TP schemes? What are these local area plans? So for example, if you're looking at a peripheral area, and like I mentioned, they grow very fast. So in the first image, in the before image, you see, typically there's, an arterial road that needs to be done. If you look at the first after image, the way is to acquire the land for the road, build it and leave it. But what happens is you get another white field like the one you saw in Bangalore, but the rest of the area continues to have very rural networks. The land parcels have not been shaped appropriately for urban use, and hence it does not lead to good outcomes for an urban use. Whereas what you see as the last image, the second after image that you're seeing, if the whole area, you need an area development approach which looks at the land, you release lands for public purposes. Like if you see in this image, the red color could be for, say, health purposes or education purposes. The yellow could be other amenities or, a substation, for example. Green open spaces reserved. So, and this is also done, for example, to reserve for affordable housing, saving some amount of land for affordable housing. So all of these sort of benefits of bringing in, say, public infrastructure, public health infrastructure can come through schemes like this. This could be done in brownfields, or they could be done in a greenfield as well. In a brownfield, it will be a redevelopment approach, or you look at certain opportunities where you can create public purpose lands for these kind of things. Yeah. The last and my final slide. Yeah, there it is to really understand and recognize informal transactions. This is very important because, like I mentioned, at the start, 50 to 80% of our economy is informal in India, depending on the city. Some of it, yes. I'm not saying everybody is not is badly off. No, there are clearly gradations of who is well off and not in the informal sector. But when we're talking about vending, which is another area of interest in the Building Healthy Cities project, it forms a part of the informal economy. There are many connections that happen over time. For example, this image, this is a project we did in Manikchowk in Ahmedabad. It was done along with Gale Architects. That's a whole report and study. Please look it up on WRI's websites if you're interested. But you can see the first image on your left and the image below. It shows temporality. in the daytime, the same area, in fact, there are 6 layers of activity. People from Ahmedabad know this very well, whether it's, from feeding animals, religious activities, to parking, to, evening becoming the hub of street food. The whole temporality of activity, the informal sector is very important. Similarly, in terms of who sits next to whom, right? So if you look at the shops, if there's a garment person sitting in the formal shop, the person outside is selling, earrings or other things which are related to that particular dress. Similarly, they share resources, whether it's water, whether it's waste, whether it's, natural markets. You can't place certain types of vendors in certain places. Like supposing I'm a flower vendor, I'd like to be near the temple. So all of these aspects of how negotiations happen, how transactions happen, should be mapped. They should be addressed before making policies and plans for them. Thank you. I'll stop with that. Yeah.
Thank you very much, Rejeet. I think that was a very good and in a very short time, you took us through almost from the legislations to the ground realities of how hawkers should be given space. I think that was an amazing scope and the range of policies that you kind of brought forward. Very nice. With that, now I would request Dr. Anuradha Jain to take forward this discussion further. Dr. Anuradha Jain, over to you.
Thank you, Ashima. 3 great presentations, Amanda, Rejeet, and from your end. And I think you have covered a wide range of topics that affect, both the urban planning and urban health, to be, from where we started with Amanda's presentation. And before I open this session for question answer session, I just wanted to add a few things, because there were 2 points that I wanted to make before we open the discussion for the audience on the question answer sessions. And one is that I just wanted to let people know what USAID is, because it is being referred to quite a lot of time and people may not know it. So United States Agency for International Development is what USAID is. And it is completely funded by US government. It is present in 129 countries across the world. And for India, primarily it is working for the last 61 years. And I can very proudly say that we are the pioneers for urban health in this country. We have spent millions of dollars working on urban health for the last 20-25 years in this country. And we can attribute the launch of flagship called National Urban Health Mission in India to the efforts done by USAID in this country. And it is not just India, but even globally, we have been working on urban health issues. And we've understood quite early in the phase what are the interactions between public health and land use conditions. So USAID has been talking about green space, zoning, transport networks, city limits, exposure to industry and agriculture and other built environment conditions for the last, I think, over 10 years on these issues. Not only this, we have a separate office called the Office of Land and Urban Use, which works out of USAID Bureau of Economic Growth, Education and Environment, called E3. And they primarily work, to strengthen the land tenure and property rights of all members of the society, and to strengthen complex urban systems and the well-being of urban poor. And as a result of the work that they have done recently, the results that we have achieved is that the land rights for 182 million people since 2013 and through new laws and policies have been achieved, and this has improved the well-being of urban poor and USAID urban policies wherever they have been implemented. So, it is, I really feel to be proud of this USAID family that has thought through the urban policy initiatives much in advance than any other country of the world has been thinking through. And India is a, India is a developing country. It's moving from being an LMIC to an MIC very soon. And urbanization is, a phenomena, as both Ashima as well as, Rejeet referred to, that that will continue. And if unofficial records have to be believed and sources have to be believed, we are already 63% urbanized in this country. So the point I just wish to make, one is that, health is something which is not governed just by the Department of Health in urban area. It is not a hierarchical approach that works in urban area when it comes to health primarily. The reason being that, if you look at the structure of achieving a universal health coverage, and this is in reference to a Lancet article that was published recently, it is a mixture of three areas, which is primarily governance, access, and social determinant, which confluence in a place. And only then, urban health is something that can be delivered appropriately to achieve UHC. And the point here is that of the confluence, very little part of the urban health actually falls in the domain of the Department of Health. It is primarily the other departments, which is urban planning, which is governance, which is transport, which is land use, that make health possible in the urban areas. And this is exactly what we are trying to do through some of the work that we are doing in BHC, as Amanda referred to. So how do you actually bring these actors together on one platform so that they collectively think as a team rather than working in their own silos to address some of these issues, so that ecosystem building, the thought process building of provision of health, for people in an urban area, whether it be through land use, whether it be through governance. And, in the last 2.5 years of implementation of the BHC, they have done some of this work very successfully by controlling the tobacco, usage around schools and education institutions, by assessing it, by getting the laws that were there implemented, by bringing various, bodies together. If I were to, refer to some of the other programs that USAID is also working in Indore, they have successfully brought departments together for strategic asset management. So some of it is related to land also, and how land can be used very strategically to provide services rationally, by building facilities around in an area. And here the health department, the example says that the health department didn't have land, the smart cities had land. The health department didn't have resource, the smart city had resources. How both the department came together, and smart city actually built a hospital for the health department, for MCH care, and that was used by the health department as a part of the land planning exercise. So the whole purpose of why I am, speaking here is that there are various ways in which health is affected. Social determinants is another way. And the kind of populations that we are talking about, to both Rejeet and, my other colleague referred to, is the people living in slum. So how do you involve community? How do you bring these people together? How do you hear the voices of those people? And to be very honest, how fragmented this system is so much brought forward by the current COVID situation in the country. And just to give an example is how the reverse migration happened, how gender-based violence was there, how people could not get livelihood and food to eat in these conditions. So all these are examples of a broken system, the siloed approach that we are working in the current situation. And so each of these pieces, and this is just the first series of a webinar, but all the pieces probably going forward that this kind of webinar would present is answering those questions of how and why do we need to bring these different facets in an urban health scenario together to address some of the health issues going forward, which otherwise is impossible. So with that, I open the floor for questions. And while people are typing their questions on the dialogue box, we already have a few questions that have come up. And so I'll open the first question for the panelists in general, because this is a general question that has come up, and I think either Ashima or Rejeet can answer to this question. So this is the question which asks about the role of zoning in implementation of land use policy. So how do you, what is the role of zoning is the question that the audience have asked. And the second question is in specifically for Amanda for her presentation. And this question is, has the dynamic mapping been done with municipal corporation or with the stakeholder including slum as well? So that's a specific question. And so with those two questions, the floor is open for all the three panelists. And just for, being very conscious of time, you have 5 minutes to answer these two questions. So I would say over to Ashima.
Let Amanda answer her question first, because I think that will be a little shorter, I'm sure.
Okay.
Would you want to go first, Amanda?
Sure.
Yeah.
Sure, yeah. Yeah, so we did the dynamic mapping. We have had 3 separate workshops with our city officials across 8 different sectors, and then including, of course, ISCDL and the Indore Municipal Corporation. We also included academic partners, other donor projects working in Indore on similar topics, and some private sector representatives. We've done a parallel process with the community, and the 3 primary groups that we have worked with have been the women's self-help groups in the informal settlement areas, sanitary workers, and youth groups. So we have been doing 2 tracks of data inquiry to build these systems maps. And actually, I should say, if you go to our website, you can look at the final context and leverage maps for Indore. And I can share the links in the chat.
And I think those people who are interested should definitely have a look at those. Those are very, very interesting mapping exercise that has been done under this project. Coming to the question, Rejeet, should I take it first? Yeah. Okay. So how does the land use zoning affects the implementation of land use, right? That's what we are wanting to say. So if we look at it in India's context, land use zoning and its related planning norms and permissible land uses, these two are attached. The moment you have a land use zone, which is essentially earmarking land allocated for residential, different type of residential in terms of densities, commercial, institutional, industrial, and all of those. And then each of these zones has their own defined planning norms and permissible land uses, which guide what is permitted in those zones and what is not. So that is what translates into what activities happen on the ground. Now, when you come to land use, when you say land use policy, so land use as a system, as a policy is defined by this development plan or master plan approach in India. And that is how these 3 things which are interrelated, the zoning map, the permissible land uses, and the planning norms. Rejeet, would you want to add something on that?
Just that, you cannot do away with a land use map and its regulations. I mean, I think globally you've kind of stuck to that layer, but it's often been understood as an inadequate layer. In fact, there's a report by the Ministry of Housing and Urban Affairs, along with SPA, talking about the failure of the land use plan in India. My own experience on working on some of these master plans in India has been, when you do assessments, master plan of Bangalore has not even reached a 20% implementation rate. I'm talking about the previous master plan, not the one that's currently working. Then in Mumbai, we found a rate of 4 to 40% of the plan has been implemented, depending on ward, 4 to 40%. In Delhi, for example, only about 30% of the population lives in planned areas. So I think these are stark numbers to understand that we are informal in many ways, not just our economy, but also our cities, the way construction happens, the way buildings, where we live. So we really need a new approach, to understand all of this and take care of it accordingly. I mean, I can talk a lot more, but I'll keep it at that. Yeah, thanks.
Yeah.
Thank you, Ashima, Rejeet, and Amanda. So, taking the advantage of being a moderator, can I ask a follow-up question, Rejeet, to you? So, whatever has happened in the past has happened, but we have a future ahead, a country which is, urbanizing very fast. So, what is the lag time between when a map is done, planning is done, and when it gets implemented in a city? So keeping that in mind in future, for example, if a smart city keeps that in mind for future and plans in advance, 3 years, 4 years, 5 years, would that be helpful?
So our master plans do plan in advance. In fact, they are so rare. For example, a Delhi master plan is revised once in 20 years. A Bangalore master plan is revised once in 10 years. So it depends on the state and their legislation. But the revision, I mean, if you revise your plan once in 20 years, you're very sure to have missed all the dynamics of the city, right? So you cannot. So anyway, a lot of challenges with that. If you're suggesting what next, I mean, I think there are enough tools available globally and in India. You have model acts. Clearly moving into the local area planning mode is critical because you can keep talking at a macro scale, at the city scale, putting in land uses, but implementation is always local. So unless your local area plans are in place, whether it's your ward committees, area sabas, if your city chooses to go that route, you need all of these structures in place to implement at the local scale. Otherwise, we will not go, we will still have those rates of 4% or 40% maximum implementation rate. For example, in Maharashtra, the TCP had come up with a number of about 30 to 50% was the average implementation rate. So if you're not even, scoring half marks, it's a question, how does this work? What is a better way forward? Schemes from the center are important. Reason being, they bring finance, they bring guidelines, they also are tied to reforms. For example, Jain URM was insisting on decentralization, was double entry accounting. There were a number of reforms attached to the money. I think these are good pushes from the center, but yeah, still a long way to go. I think local action is the way forward. That could be the best way forward. Yeah.
Perfect. Thank you, Rejeet. And I think that's a good segue into the next question that have come. And the question that the audience have put forward is that, in your view, what would be India's scope in the immediate future in terms of building more sustainable cities or making existing cities more socially and environmentally friendly for better health? So that's the first question that has come. And I think the second question again is from your presentation, Rejeet. Walkability is the answer to every urban issue in order to create healthy cities. Yes, then, and if yes, then why it has been difficult to implement it at a larger level since it's one of the highly studied parameters? Over to you, Rejeet, and Ashima, if you want to add, and Amanda also.
I think I'll let Rejeet speak first, and then
I'll take the walkability one.
I knew that
since that was directed. Since it was directed to me also, I think. Absolutely. Somewhere. One is, as shown, whether it's what Ashima showed in terms of block size, what I showed in terms of how our peripheries are growing. And don't forget how many agencies act on land. It's not just, a municipal corporation or a development authority who's doing a master plan. It's, for example, industrial area development boards, right? The Whitefield example I showed you, the industrial area development board has taken large chunks of land, up to 100 acres at a time, to put up projects like ITPL. Similarly, so all of these big chunks get taken up by housing boards, by industrial area boards. Many state parastatals have, very far-reaching powers in terms of both acquisition and development, and they don't have to be in conformity with the, local municipality or even the development plan. So I think some of these, make us structurally unwalkable in terms of, block sizes and things like that. Second, we still walk. So walking is still the largest mode of, commute in most of our cities. Like in Mumbai, it is the highest mode, followed only then by, transportation mode. So everybody is walking. Definitely longer distance are done by economically weaker sections who don't have an option, right? I mean, the whole unfortunate situation that we're even seeing today, I mean, they're literally walking home, which could be in another state, right? I mean, even if I don't consider that, within cities, we've seen people walking 2 to 5 kilometers, which is, normal for them to go to their work and go back because they can't afford another mode. Cities like Mumbai, the trains are highly affordable, so people are taking that. But these are the issues. Our inner city areas are, areas that grew slower, are of better block sizes, but the newer areas, the whole gated communities coming in, large industrial area blocks coming in. A lot of this also, taken in while we expand our cities, is breaking the walkability. Second, we've seen, like say, when you see a road is being constructed, especially highways and things like that, there's very little attention given to the footpath. Footpaths are not, put in, and like, for example, we said, what about walking and etc. They're like, standard to hai. It's like 1.5 meters is a standard footpath dimension. But what are the number of people? What is your, what we call as level of service that you're trying to achieve? 1.5 meters is okay for how many people to walk at a time. But if the bulk are walking, then what? Like, then shouldn't your, footpath keep moving up in terms of 1.5 to 4 or 5 or 6 meters, depending on the number of people walking. So all of these are questions. I mean, definitely it's improved now because there are better standards. Even the IRC has come out with better guidelines for walking and street design. There are important documents, like say in Bangalore, Tender Show came out, which has a great focus on walking and putting in infrastructure below ground level. So there is movement in many cities, and I think COVID is the great, we should take it as a threshold for the better and not for the worse. Cities globally are saying, let's now reapportion our roads, to widen our streets, to widen our cycling lanes. And I think, there is a competition now from the center as well. Cities also looking at it. I mean, we are part of some discussions in Bangalore, for example. They're going to reapportion roads to accommodate walking and bicycling. So I think these are great positive signs, and we should build on them. Yeah, thank you.
If I could just give a quick example from Indore, because Indore, through their smart cities, have actually been funding quite a bit of sidewalk building. But on my few visits there, you'll see a brand new sidewalk is damaged or dug up because they're building a building right next to it. So that's one, as a fast growing city, the city is putting in and prioritizing sidewalks, but then the coordination with the construction of the buildings is not happening. And then in other places, you'll have a brand new sidewalk put in, and all of a sudden that's a parking lot for motorbikes. So there's a behavior change aspect too. Yeah.
Yeah, I think that's a story of almost all Indian cities. I mean, it's not something new, and especially those which are growing at a very rapid pace. I'll now go to the other. I think walkability, Rejeet kind of covered very well, so I'll not waste time on that. I'll go to the other question that Anuradha, you had put forth, in which you said India's scope for immediate future in terms of more sustainable buildings and thus making them more healthy. Like I said in my presentation, I already discussed some of these ideas. There were also many things like building building designs, starting from the materials that we use for buildings to the kind of designs that we have. So in India, in a country like India, which is hot and which is a kind of climate that we have, we don't have cold climates, we have hot climate here. So what are the kind of, if you have too many glass facades, and how are we making them more comfortable and more, again, if we make those glass boxes, we are increasing the load and need for air conditioning. And that's not really a sustainable approach. So it almost starts from every building and house that we make to going up to a larger level. We are even where we are also looking at wastewater recharge, groundwater recharge, rainwater harvesting, urban agriculture, and many of these other concepts which are at the city, and some of them are also need to be implemented more at a regional context. So it's not that we are not aware, and it's not that we are not making an effort. The only problem is we are making efforts in bits and pieces, and we are making an effort only to a level where it is impacting a smaller part. We are not even looking at a city is not just a city, it's not an island. It is a city which is a part of a region, which is a part of a larger biodiversity and ecological system. And so lots of these things, the moment we say sustainability, we are talking about ecology, and we're talking about environment and its air, and all of these things actually don't see administrative boundaries. These administrative boundaries are for our ease and comfort of implementing things and for funding things. But what is important to understand is that ecology crosses beyond. And so we should not limit our approaches to restricting ourselves to saying that, oh, I'm looking at this smaller problem at this level, and I'm not going to contextualize it with respect to the rest of the things around. And so one needs to zoom out and see for a change and then intervene. So a global or a larger contextual approach, but an intervention can be local. And then it has to be at a very rapid pace and I think these many of these central projects that we were talking about earlier, like Smart City or GNNURM, which was earlier, have been instrumental in providing these funding mechanisms to large cities and even small and medium cities to implement many of these ideas. And I think more and more such boost is what is going to have help that. I just feel, just to end it, many of these things are not made mandatory. They are just guidelines, or they are just suggestive. So because of that, people don't kind of choose. They outweigh the other benefits, sometimes financial, other and economic, other kind of benefits. And these things kind of take a back seat. And so if we need to have sustainable approaches, this need to be in the forefront, and this has to be instrumentalized with a more legitimate kind of instructions, which could be state driven, which could be central driven, which could be driven by with reference to the grant and the money that they are getting. And so that if it links like that, then even the cities would be forced to take that effort. And obviously a continuous monitoring and evaluation of these aspects is equally important, because again, we don't want these approaches and these solutions to be done only at a superficial, only touch the surface level, but go deeper and more long lasting. Thank you.
I totally agree with you, Ashima, with your last point, at least, where you say that operationalization of all these policies is, not sustainable, and not because probably people don't want to, because these are tough decisions to make. And also, the technical capacities in some of these areas to actually implement them on ground on how to do it, even for that matter, taking a plan into action when it comes to real terms is a difficult task to, take in. And, I have a series of questions. I think I have 15 of questions that need to be answered, and we are running out of time. We just have 6 minutes in hand at this point of time. But what I am tempted to, ask as a moderator to all of you is that, you talked about pavements and how pavements should grow. But what we have seen in real life situation is that the places where vulnerable populations are, the slums where the migrants live, and where the COVID has maximally impacted those populations, you know, the smart cities, how inclusive are they for those slums? How they are considering them as part of their overall plan? I think we need to start thinking about those questions and answering some of those questions. Because why a woman doesn't walk in a slum is not because there is no road, but there is no light. And there is huge gender-based violence against those women that happens on the roads of slums, whether it be kacha or paka. So I think pondering on those questions would also be important, for experts like you, and come up with some sort of solutions for us. Maybe when we go forward in the series of webinar that we are talking about. So with that, I think there's another question for you, Rejeet, that has come up. So the question for you is, can UDPFI guideline provide urban agriculture at different level from housing to sector or to city levels? And from government workers in Canada, what can an urban planner or designer can learn from the democratic approach of informal settlement, and how can policy leader empower citizens to build their own cities housing? So with you, and then to Ashima, over to Ashima for the second question probably.
All right. So on the urban agriculture, in fact, I think Ashima had presented on urban agriculture. I don't know if you want to exchange, we can, and I can take the second one on housing. But anyway, either ways, maybe I'll
that's okay. That's absolutely okay. I'm fine with it.
Yeah, all right. So I think, in fact, Ashima had alluded to this. The UDPFI is a guideline. In fact, it's URDPFI right now. In fact, something that even WRI has contributed to in terms of its formulation. So definitely these are guidelines from the center, but at the end of the day, at the state level and at the city level, it needs to come into regulations. Now, you are not prevented from doing, say, rooftop agriculture, for example, but then the question is, how do you then source the water for it? For example, it cannot be the municipal, water tap that's extremely expensive water that's been, cleaned and transported very often over 100 kilometers to come to your house. So, so understanding sort of these cycles, if it is wastewater from your house that you're able to, divert minus the chemicals and minus, certain small purification process could be done. That definitely helps, and I've seen a lot of good examples, of course, a few and far between examples of urban agriculture in cities and on rooftops, etc., and other areas where possible. But of course, you have to understand where is the land. You don't have land for open space or health or social infrastructure. So where are you doing it? You're largely going on rooftops. So yeah, I think understanding, the structural components, whether you can put in that amount of, sand or mud into your rooftop, is your building structurally stable enough for it? Where is the water coming from? I think these can be done at local levels. What has been insisted through regulation, like say development control regulations, for example, very often is, they insist in some cities that if you're reconstructing, you have to put in one tree for this much area. Or the other one that's being insisted on is rainwater harvesting. Another thing that's incentivized is, say, solar rooftops. So many of these sustainable solutions are being mandated, like the tree and the rainwater harvesting is mandated in many cities. Urban agriculture could become another one that we could look at. Yeah, sure. Yeah.
And I think also the idea that I did talk about was incentivizing the private landowners about allowing urban agriculture on their land parcels till the time they are not developing it in the peri-urban areas, those vacant lands. I think some of that that could be an incentivizing policy which could be done, but with all of these will have to be done at the local level. Coming to the other question, so what can we learn from the democratic approach of informal sector? So India is essentially, so this question is from a government worker in Canada, and India is a democratic nation, and most of our land here is owned by private ownership of land. And so any changes or any development that we have to do, the owner of that land, whether it is a government body or it is a private owner, will have to have consent on that use. When it comes to slums or the informal settlements, most of these settlements in India are located on land parcels which are either government or private but encroached, or they are disputed lands. So essentially those informal settlements many a times do not have the land rights. However, in the process of regularizing these informal settlements, the tenure to those lands or to those settlements is provided by regularizing and organizing these slums and these informal settlements. So we can definitely, what we can do to empower the citizen to build their own neighborhoods or their localities, particularly if you look at the informal settlements. One is that these people do not have funding. Second is because of the reason that their priorities in life are very different, because of the reason that if you will say that I give you this money and you put a permanent roof on your house, or I'll give you this money, you build a toilet, they will probably want to use that money for something else, because we do not realize many a times that their needs are much beyond what we are even thinking. As a solution, what we've done is that we have either done improvement plans within these informal settlements, which is providing of some water sanitation facilities and other such improvements, maybe providing some street lights, maybe providing some, improving some road infrastructure and things like that, or at times relocating them, which is, I think, the worst thing that we can do, especially when we relocate them to a completely different area, which most of the time is again very far away from their workplace, and they don't even have access to public transport there. They don't have access. They do not have vehicle. They cannot travel that long every day for work. And in that whole struggle, they lose their jobs and a source of livelihood also. So the in situ development of these informal settlements is important. And many of the successful cases have actually shown that, when you have public participation or a community engagement from the design stage itself, where we kind of rope them in. Rejeet was also talking about that community engagement of stakeholders for the policy. So any change, if you're doing something which is going to affect those people, then we need to talk to them from that point itself. If we go and talk to them only at the point once we've made a decision, or once the policy is already defined or the plan is done in the boardroom and approved by the certain committee members, then there is no point. The problem is because public participation and community engagement in most of our project lacks that depth and that intensity that it needs to, especially when you're doing it for this set of social sector. Rejeet, you want to add something to this?
Yeah, I just thought I'd give two examples. Sorry, Amanda, do you want to go first?
Just very quickly, and I put some of this in the chat, but BHC is testing some community-led data collection and advocacy campaigns so they can define what their priorities are and bring them to the city directly rather than having us as a go-between. And as you say, sort of making sure it aligns with the work plan, the yearly work plan process, so that information is being fed to the city when something can be done about it and things can be budgeted for it.
That's very good. Yes,
I thought since they were interested in looking at a policy or something, one is in the current Pradhan Mantri Awas Yojana scheme, which is the current centrally led affordable housing scheme in India. You can look up the BLC component. There's something called beneficiary led construction component. It is actually the most successful component of the current centrally led scheme. They actually give you a credit subsidy. So you get, and if you are eligible from the economically weaker section, you actually get about 2 lakhs of rupees to improve your house. So it also means you have, access to the land. You are either having a right or a title to it, but you can avail this money from the center to upgrade your house. So that's interesting because it's helping somebody who doesn't have the finances to build or improve his house on his own plot of land. So that's one. Another one where this is the government of Odisha. It came out. It was quite a revealing policy at that point of time. They have now in many of their smaller cities given tenure rights. So this is a large scheme, and this is quite interesting because not only, and this is not for the big cities, mind you, but it's for the smaller cities. Along with the tenure right, which means immediately, you don't have the fear of eviction. They've also done a lot of convergence of schemes, which is quite interesting, which is, bringing in, say, supposing it's Swachh Bharat or it's the Amrut scheme where you're looking at infrastructure, their own state schemes for, say, food, giving free food, because they see that as a basic requirement, right? For you to, for your basic functioning, thinking, improving your own lot, you can't be on a hungry stomach. So they've tied a lot of these schemes and improvements together, interesting convergence in Orissa. So that's something you can look up. I just thought I'll mention 2 schemes. Yeah, thank you.
Thank you, Rejeet, for bringing up Odisha as an example, because that's the most outstanding example, even when, the mapping of health facilities concerned. Otherwise, the major problem that Ashima mentioned, which is relocation. And what happens during the relocation is that the people move out of that place, but the facility to provide care to those people, including the health staff, the frontline workers, still remain in that area. They don't go to the new area because that doesn't become part of the relocation plan. And by the time it becomes part of the relocation plan, for the next 5 to 6 years, people do not have access to facilities. So that's the way, health and the other infrastructure, development works. And it's a big loss to people, a huge out-of-pocket expenditure for them. So since we are running out of time, we are taking 5 minutes extra to have our last 2 questions put forward to panelists, if you agree. Shall I go forward? Okay. So the question here is, what could be done to retrofit cities post-COVID scenario with emphasis on peri-urban areas and intermediate areas between municipal limit and villages? That's a great question. How does one measure and calibrate the benefits to the environment that is brought about by having favorable built environment characteristics? Over to any one of you who wants to answer.
Could you repeat it once again, Anuradha?
Yeah, sure.
Yeah, please.
So what could be done to retrofit cities post-COVID scenario with emphasis on peri-urban areas and intermediate areas between municipal limit and villages? So that's slightly complicated.
Yeah.
How does one measures and calibrate the benefit of environment that is brought about by having favorable built environment characteristics?
I can give a quick, it's not going to be nearly a thorough enough answer for the first one, but I do think that a focus on the water and sanitation systems, including, proper drainage, is going to be a huge benefit to COVID control in these newer areas. And then for the second one, I can't speak to this in any comprehensive way, but I know that there is an effort going on to talk more about the microbiome of cities and how that affects people's health. And I was shocked to see the evidence around how properly planned cities with green space and residential areas aligned can have such an impact on human health. So that's something that people can look into if they're interested.
Rejeet, do you want to go first?
I can take the peri-urban one. We do a lot of work in suburbanization, so happy to speak to that. One is, what is the retrofit you can do? Some areas, like you see, when those road networks, I keep referring to the Whitefield example, since you would have seen that image and seen how, sort of disconnected and dispersed those road networks were. Road networks typically we say have a life of at least 100 years. It's very difficult to change it once it's in place. Buildings may be about 50 years. But then what we, in fact, since these are things we're working on, we had actually spoken to, take the case of Bangalore. We actually spoke to, there's an IT Industries Association in Bangalore. And when they actually, in fact, this was, if some people remember a few years ago, in the newspapers it had come that, the traffic levels were so high because there were very few main arterial roads, and there were no sub-arterials in place. There was actually, a note that said, if you don't fix the traffic, we're going to leave from here. We're going to take our investments and leave. So that was a concerning moment, I think even for the Chief Minister in Karnataka. So there were discussions on what could then be done. So when we did a quick assessment, we looked at this outer ring road in Bangalore, and we saw that all the IT parks, which are huge, like 100 acres at a time, have actually taken huge blocks of land. So there's no, beyond the arterial, there is no sub-arterial, there's no collector, there's no feeder, there's no local road. So this is just one big arterial. So even for your local shopping, everybody comes on the arterial. So we actually looked at the map and we found there were enough opportunities within these large, gated blocks to actually let thoroughfares happen. Allow sub streets and multiple options without touching the existing buildings. So we actually made conceptual plans of how these sub-arterials and arterials can, local and feeder roads can come in, and had a discussion with, this was both a political discussion as well as an IT organization discussion, and many of them were open to it. Of course, somebody had to take it through, and that part didn't happen, but you can look for urban opportunities, and you will find them across. You just have to look for opportunities. So that's one example of an opportunity to retrofit. Another option is to look at decentralized services. In many ways, there's solar, there is, you can clean your water on site. In fact, I've been in some conversations where they say, cut everything off, cut off your municipal services, you can manage on your own. So why not look at these decentralized solutions? There are enough startups also coming up with many of these decentralized solutions. I think it's worth looking at as a way to service a lot of these areas, which are managing otherwise through self-provision.
Sorry, I think there were very valid points, Rejeet, that you made, and Amanda, you also things you pointed out. I would just want to reiterate what Rejeet, you were talking about decentralizing, and to such an extent that I would even feel that these peri-urban areas many a times don't even have access to daily needs and essentials. So many of the times, I live in an area in Ahmedabad, which was which became a part of Ahmedabad post it got developed. Till that time, it was outside the municipal limit. So it is on the outskirts of Ahmedabad, earlier Ahmedabad limit, and it was earlier outskirts, Bhopal. So this whole region, this area actually developed to a full-fledged neighborhood with buildings, with commercial, with residential, and with everything happening, but with no municipal water or sanitation facilities. These people were living on tankers, water tankers, which would feed their overhead water tanks to provide water. And they only had septic tanks and other such things for sanitation facilities. But they were all sustaining in their own sense otherwise in terms of commercial needs and daily usage requirements. Now, at this time of COVID, what I've really seen is that many of these peri-urban areas get affected and they find very difficult when they don't have access to basic needs. Now, these infrastructure can still be managed like in a decentralized way, what you mentioned, but provisioning of these spaces where such kind of daily requirements, essential needs are easily available within walkable distances so that everybody can reach out. Even when there is a curfew, there's something else, but you are able to quickly go and grab something, whatever you want to. At least food is healthy food, clean food is available. I think that's very, very prime. This brings me to a very age-old theory, which is called a multi-nuclei theory of urban areas. Cities or urban centers, gone are the times when there used to be only single nuclei. The moment the city grows beyond a point, it has to be multi-nuclei. And I think these peri-urban demand that more and more. The only difficult part is that we leave a bit too much of that on the market. We expect the market to take charge. We expect a developer to probably find, a benefit in making a shopping center there. And so he'll take 2 years, 3 years to make that building. And then another 2 years it will take, or 1 year it will take for those to get occupied and people to finally establish their shops. Until that time, the residents of those peri-urban areas actually have to drive down probably 15 minutes, sometimes even half an hour to reach out to some of the basic things that they need. So I think we need to leave it on the market, but we also need to fortify it within the plan and facilitate some of the older approaches of town planning schemes that were done in Ahmedabad, in Gujarat, I would say. Some of the earlier ones used to define these areas. There used to be a school in every neighborhood, a health center in every neighborhood, a municipal market in every neighborhood. But now, as we are growing and we're leaving everything on the private sector, I mean, it's good in that sense, but one can always incentivize and provide other facilities in those guidelines and legislations, which can encourage people to, while that neighborhood, that peri-urban area is developing, for these things to also develop simultaneously. So that's, I think, very critical here. Coming to the other question, how does one measure and calibrate benefits to the environment? So there are different ways of doing that. There are environmental models which can help you convert it into the carbon footprint reduction. They can help you even calibrate the economic benefits that have come in because of those approaches, or those environmental safeguards that you've done. So there are this called environmental impact assessment is one process, and there are methods, environmental modeling methods in which you can calculate. So I'm not an expert in that, so I cannot give you more details, but there are technical systems and methods which can help you calibrate how much benefit to the environment will it bring in. For example, recently in my neighborhood, there is a biodiversity encouraging naturally grown forest which is designed next to a public area, in a public garden. So on a public land, a portion of that garden, the municipal corporation gave away to this, I think it's called the Miyawaki or something like that. It's a Japanese process. And so they kind of make that forest, and then that forest becomes self-sustaining. You don't really need to do anything about it. So these kind of approaches, and they have actually calculated how much of the carbon sequestration would happen because of that. And there are various studies that have happened in the past. There are many experts working on this. That's it from my side.
So that was our last question, Ashima, Rejeet, and Amanda. And that was a great discussion, I must say. I learned a lot. I don't know about others. Maybe the topic is very new to me. So I learned a lot today. And I intend to do more of learning in this area because I think it's quite closely related to what we do in health and the climate change that affects health. So this has a great impact on it. You know, because of the scarcity of time, we are no more moving ahead with questions. But this is very, very interesting. And let's you know, keep some of the channels on for people who would like to keep these discussions on beyond the webinar on some of these issues. With that, I thank both the panelists and the participant and hand it over to Ashima for any final words. Thank you.
I think, as mentioned by Anuradha, this was a very wholesome kind of a treat for all of us. I am sure the audience also kind of enjoyed it. And it was very interesting to listen from Rejeet and Amanda. And I have never been to Indore, so that case, now I wish I could visit it as soon as possible. There are many questions that we've received. Like Anuradha said, we will find a way to answer those. We will have them recorded to us, and we will have our panelists look at those. and all of us will have some opportunity to answer those. We do have this whole seminar, the session of today on FB Live also. You can repost your questions there as well, and probably we can reach out to you. And I think that it's a great, so this is just a beginning of a thought process in this sector. And I hope that we are able to bring forth a lot of many things, because this is a very, very broad subject. And there's a lot that we can do. There's a lot of scope that we can do in this. And we will definitely keep our participants updated if we have any new agendas and discussions, point of discussions that we will take forward from here. And thank you very much. With this, I would want to thank Rejeet, Amanda, and thank you very much, Anuradha, for agreeing to take forward this discussion, moderating this discussion. I think it was very fun to hear you out also, along with our answers. I think you kind of built that thread in, and I think that was really interesting. And thank you very much. And in addition to that, I would also want to thank our backend team, the IT, Harsh, who works with me, Rutu from communication, and Pragnesh, who's been handling the IT. And thank you very much for the seamless, except for my presentation, which kind of got affected a little in the middle, but I think everything else went seamless, and I'm glad we did this. Thank you very much, and have a great evening. Thank you.
Thank you. Thank you very much.
Thank you.